So we're talking today with Dr. Leslie Gaskill in her office. I'm Alpha Trivette, a patient of hers and part of her board of plaque busters. And there are hidden factors that could cause risks for heart disease, and one of those hidden factors is our gums and teeth.
That's exactly right, Alpha. How did you find out about that?
My vet told me.
Your vet?
Yes, my wife insisted I go in. I was having a problem with fleas and scooting across the carpet and that sort of thing. But no, we took our dogs in for their checkup, and the vet looked at their teeth and said, "You really need to keep the dog's teeth clean." And I said, "Well, I mean, they got a pretty smile." He goes, "No, it's more than that. It could put them at risk of heart disease. Heart disease from my dog, from their teeth, and it works the same way in humans." How's that?
Very good question. Periodontal disease is a very big cause of inflammation. And if you have inflammation in your gums, your mouth is obviously attached to the rest of your body, and inflammation becomes systemic, meaning it's throughout your body. And inflammation is a big root cause of cardiovascular disease and atherosclerosis, which is plaque buildup in the arteries.
So plaque on your teeth, plaque in your heart, it could be related then.
Well, the plaque in your heart is a different kind of plaque from the plaque on your teeth, but the plaque is ultimately formed from inflammation. The plaque in your heart and in your arteries leading to the brain to cause a stroke are ultimately a result of inflammation.
And the thing about that is, a lot of times we think, well, if you got periodontal disease, you know it because your gums are bleeding, they're swollen or whatever, but that may not be the case either. That's
a very good point. Periodontal disease can be silent, just like heart attack and strokes. Pending heart attacks and strokes can be silent. You can be fine, you can run a marathon, not have any symptoms, and turn around and drop dead of a heart attack or stroke. So it's important that patients be aware that they need to find a dentist who can appropriately screen for periodontal disease, especially if their physician has told them that they have other risk factors for heart disease and stroke.
How do they screen for that?
Certainly by using a oral DNA test, which is a saliva test that dentists can perform. Certainly an exam, x-rays, that kind of thing.
And how can you collaborate with the dentist then to make sure that we stay healthy all throughout our system?
It's important that physicians and dentists do collaborate. Calling the dentist calling the physician, hey, I've got a patient that's got significant risk factors for cardiovascular disease, or they already have coronary artery disease or cerebrovascular disease. And if I'm concerned about them having a heart attack or stroke, I need to make sure that dentist does appropriate screening. I'm certainly not a dentist. I mean, thank goodness we have individuals who are highly trained to do that kind of thing, but we need them to be able to work with us together so that we can get to the bottom or the root causes of why that patient has plaque buildup in their arteries in the first place.
Finding all those risk factors that could put you at risk for heart disease.
Exactly.
Right.